Good day, everyone. Thank you for joining IBPF today and Bianca Zabel, our presenter. Bianca is an integrative health and wellness educator, yoga and mindfulness teacher, and social change entrepreneur. She is founder of Integrative Wellness, an integrative health and wellness firm, yoga instructor, somatic experiencing practitioner in training, and social change entrepreneur. Bianca's intention is to be in service to the fullness of the human potential. After receiving a Bachelor of Science majoring in Allied Health and Health Promotion, Bachelor of Arts majoring in Fine Arts, certifications as a Hatha Yoga instructor and Shambhala Reiki master, she began to empower wholeness at the individual, social, and worldly levels, deepening the awareness and impact of her students and clients. Today, she will share with us how yoga can help many symptoms of depression and bipolar disorder, including mood swings, fear, anxiety, tension, and lethargy. By opening your body and centering your mind, you can balance the ups and downs of bipolar mood swings and change anxiety to calmness, sadness to happiness, and lethargy to vitality, and much more. Welcome, Bianca. We're very happy to have you today.
Thank you, Debbie. Thank you for having me, and good morning, everyone. So I am very honored to be here this morning and to share with you some of my own practices, my research. This is all a course of over 15 years of yoga practice with and being really a student. So that's what yoga is really about, is just being a student, and a student of breath and always staying teachable. And that's the best thing about being a yoga student, is that when we're open to learn, we can learn so much. So thank you so much for being here this morning. And please, at any time, anyone, please ask questions and type them in. If I'm unable to answer them in the moment, I'll write them down, send me your email, and I'll be able to respond and answer more thoroughly with some sites and resources for you as well. So let's get started. So we're going to start here in our first slide. And I call, when we start yoga and meditation, beginning the healing journey, because millions of people suffer from depression, anxiety, making antidepressants the third most commonly prescribed drug, with continued increasing use over the past 20 years. Yoga is a form of meditation, an exercise that connects the mind and body in a unique self-guided healing process. The use of yoga has increased over the past 10 years. Studies have found benefits of yoga for decreasing depression and anxiety. And I really saw this happening when I was working in education. I taught junior high and high school for 4 years. And I started a yoga and meditation program, and I wrote curriculums so junior high and high school students could take yoga and meditation for PE, physical exercise, an elective, and for their wellness program. And so that is where I got to physically see that when people, particularly kids and adults, were practicing yoga on a consistent basis, 2 to 3 times a week over a long period of time, that the symptoms of these conditions started to decrease, and vitality and many other wonderful things started to happen in their system. So if you're dealing with depression, anxiety, or other mood disorders, yoga can be an appealing way to better manage your symptoms. Scientific studies of yoga demonstrate that yoga therapy is a low-risk, high-yield approach to improving mental health. One of these studies found that after 3 months of yoga, study participants reported their depression improved by 50%, their anxiety improved by 30%, and their overall well-being improved by 65%. Other studies of individuals with bipolar disorder, major depression, and schizophrenia also reported a significant drop in levels of anxiety, depression, anger, tension, hostility, and fatigue. And I had a firsthand experience working with UCSD last year. We ran a 3-month study, and if anyone is interested in seeing the data, we just published all the findings. And I was a yoga instructor, and partnered with UCSD, and we studied the effects of how yoga and meditation affects the parasympathetic nervous system, along with many other questions that were asked. And the study showed significant data that yoga and meditation significantly affects weight loss, depression, and anxiety. So I'm very excited to be part of new evidence-based data and research that shows the positive and significant impact on our system. So yoga can also contribute to your overall physical fitness by targeting your flexibility and balance. Along with adequate sleep and a nutritious diet, exercise, flexibility, aerobic, and strength forms the basis of general good health. Good overall health can help you heal with a chronic illness like bipolar disorder. Bipolar medications are very good at taking care of mania, but they aren't as effective at managing anxiety and depression. Similarly, medications used for anxiety and depression pose a risk of triggering mania. Adding yoga and meditation as a complementary treatment for bipolar disorder can help people better manage their symptoms and possibly reduce the amount of medications they need to take. Yoga helps bipolar patients reduce feelings of depression, anger, and anxiety, and calms emotions. So how does yoga work? How does it work? So simply by reducing perceived stress and anxiety. Yoga appears to modulate stress response systems. This in turn decreases the physiological arousal. For example, reducing heart rate, lowering blood pressure, and easing respiration. There's also evidence that yoga and meditation practices help increase heart rate variability, an indicator of the body's ability to respond to stress more flexibly. Many studies found that practicing yoga may elevate levels of gamma aminobutyric, GABA, in the brain, which positively affects a person's ability to handle stress. So let's talk about meditation here. In the last decade, medical science has discovered something already well known within many cultures. Meditation can be a potent part of any holistic healing program for people with bipolar disorder. Meditation equalizes everything, including unbalanced moods. Bipolar patients who introduce meditation to their daily routine see a greater sense of peace, a leveling of their moods for at least several hours after each meditation session. Eventually, meditation leads to an overall higher state of mental awareness all the time. Never getting too high or too low, constantly maintaining a well-balanced yet advanced state of mind. Meditation boosts the very same neurotransmitters that bipolar medications do. Insufficient serotonin, dopamine, and GABA, all super important brain chemicals, greatly impact mood and overall mental health. It may come as no surprise that bipolar medications, SSRIs, work to increase all of these mood elevating chemicals. No need to pop a pill when meditation will normalize all of the above. So not to say that, of course, you stop medication. These are complementary interventions. So it's saying no needed to additionally continue to pop more pills. So meditation makes you a witness of your thoughts. The fluctuations of the mind do not emotionally affect those while in a state of meditation, nor while outside of meditation for the skilled practitioner. Once the meditator's mind becomes naturally detached in a healthy and good way, he or she does not attach to a particular state, whether high or low. Meditation puts you in the driver's seat of your mind. Meditation activates the brain's CEO, the prefrontal cortex. So I love this analogy. So you'll just think of the prefrontal cortex as the center, as the control center of the brain, with executive functions such as knowing right from wrong, good and bad, outcome of actions, and overall orchestration of thoughts. Of particular significance, the brain region has a major effect on personality disorders, namely depression. Studies conclude that meditation healthfully boosts this brain region, effectively smoothing out the manic while deactivating the depression. Meditation can bring a normal life to a bipolar sufferer. Once the practice of meditation becomes habitual, the bipolar client will develop an internal set of skills, such as moving from a state of confusion and anxiety to one of peace and inner calm. Meditation may be the closest thing to a cure for bipolar disorder, leaving an ordinary life within reach. So now we're going to switch gears, okay? We're going to look at yoga for weight loss. So as you can see, as meditation and yoga affect the physiology and the brain chemicals, we're going to look more closely and in particular yoga for weight loss. As we know, yoga is known stress buster. It's also one of the most effective workouts for fighting stubborn fat stores, especially the ones that crop up after the age of 40. And I'm almost getting there, so I'm very interested in this. Yes, you can use yoga for weight loss. The reason, studies show that yoga lowers levels of stress hormones and increases insulin sensitivity, a signal to your body to burn food as fuel rather than store it as fat. Yoga for weight loss benefits are both physiological and psychological. Calories burned during yoga vary widely from 108 to 360 calories per hour, depending on the type of yoga you practice. And this was shown significant in the data when I worked at UCSD on the yoga study. Okay. Better overall health. Losing weight by doing yoga also conditions the internal organs and systems in addition to getting rid of the excess fat. This means that not only will you lose the weight, but as you continue your practice, you will find yourself getting more and more healthy and fit. In addition, you will enjoy all the profound benefits the yoga bestows and not just the weight loss aspect, because there's no bad side effects. So also, always remember that the body has a blueprint for perfect health and always tries to return to this state. You should always try to work with the body and in its efforts to return to a perfect health. Yoga and Ayurveda is the Indian holistic science of life and longevity. It's the sister science to yoga, are designed to do this. On the other hand, when we use chemical, surgical, or the quick fixes, we tend not to work holistically with the body. And even as you are fixing one problem, sometimes we tend to create more problems. So using yoga for weight loss is the best way to intelligently and naturally lose the weight and help the body return to optimal health. Permanent weight loss with yoga. So experiences of the yoga therapy programs to treat obesity have shown that weight loss from yoga therapy has proven to be permanent. This is certainly not the case when we use chemicals or other like gimmicks, you know, like weight loss program or fads. The weight loss by those methods tends to return in a hurry once they have discontinued. This is not the case with yoga as long as you maintain at minimum a healthy diet as prescribed by Ayurveda or whoever your prescribing doctor is. So when you use yoga for weight loss, the body is gently brought back into alignment and underlying causes for the weight gain, whether they are emotional or biochemical, are also resolved. Also, since yoga works with the body to achieve optimal health, the excess weight once shed is no longer regained when the yoga is stopped. I would though recommend continuing the yoga practices if you can, so you can continue to obtain all the other benefits such that practice bestows. So what's nice about yoga practice is that it begets itself. So a very famous yoga teacher named Patabi Joyce, who started Ashtanga yoga, said practice, all is coming. And that's what that's about. You know, we continue the practice and it bioaccumulates the coherence and the benefits. So that's why extreme exercise is not necessary. Studies show that even gentle yoga exercises done with moderate effort are good enough to put you on track to meet your weight loss goals. And we saw this at the UCSD yoga study. So you don't need to undertake extreme fitness regimens. Such regimens are generally short-lived anyway and can be injurious to the body. Yes, when doing yoga in this sensible way, the weight loss is not going to happen overnight, but you can expect to consistently lose 5 pounds a month safely and naturally without doing harm to your body or mind. So let's, if we have any questions, shoot them through. We're going to continue now, switching gears for yoga for mood balancing, which is really phenomenal. This is yoga can help many symptoms of depression and bipolar disorder, including the mood swings, fear, anxiety, tension, and lethargy. One way yoga helps is to release energetic blockages that are called gratis in Sanskrit. These are knots that form in the navel region, the seat of personal power, the heart center, and the seat of the emotional body, and the throat, the seat of self-expression. So when we release these blockages and our physical and emotional layers open and energy flows freely. This energy is called prana, is the essential life force of all beings. When prana flows freely through the body, we feel vital and healthy. We reconnect with others and become a part of the world. A sequence of yoga poses and breath work is designed to help you release your blockages, to untie your knots. Doing these sequences regularly can bring into your life a glimpse into our connection with universal energy and its abiding, supporting role in our well-being. By opening your body and centering your mind, you can balance the ups and downs of bipolar mood swings and change anxiety to calmness, sadness to happiness, lethargy to vitality. You can glimpse your connection with universal energy and find its abiding, supporting role in your well-being. And this has been my experience. So I'm obviously an avid supporter. So according to Stephen Cope, a psychotherapist and author of Yoga and the Quest for the True Self, Hatha Yoga's postures improve mood by moving energy through places in the body where feelings of grief and anger are stored. Hatha Yoga is an accessible form of learning self-soothing, he says. These blocked feelings can be released very quickly, creating a regular, systematic experience of well-being. So how does yoga release emotional blockages? Every experience in the mind is accompanied by shifts in the brain's and the body's chemistry. When you say, I feel depressed, you're acknowledging that your body is generating disturbing sensations. Feelings are so named because we feel, and that's important, we feel them in our body. The sensations result from changes in hormone levels and in the pattern of nerve firings within your nervous system. These physiological shifts can persist long after the emotional upsetting experience that first triggered them. Over time, your mind-body system reflects your emotional history. So through yoga, you can release the emotional toxicity stored in the body. Just as changing thought patterns can influence the body, changing the position of the body can influence the mind and facilitate emotional release. As you stretch your muscles and expand your range of motion, you shift the bodily patterns that trap emotional pain. Yoga poses, breathing practices, and meditation release the constriction and free the flow of vital life force energy known as prana. For instance, slow, deep, conscious breathing is very effective in prompting the relaxation response to counter elevated levels of stress hormones. An important component of yoga is paying close attention to what is going on in the body at all times and locating and releasing any areas of tension. Although you can feel the healing effects of yoga just after one session. A regular practice is required if you want to experience the full benefits yoga offers. In addition, yoga should ideally be practiced with the guidance of an experienced teacher. There are many yoga styles and traditions to choose from. Some have a greater focus on physical fitness, while others are more meditative and spiritually based. It's important to explore and find a practice and teacher that resonates with you. Okay, so eating a mood-boosting diet, and this is very important. As yogis, they go hand in hand, and so I wanted to inspire and really put this in the slides today, because what we eat is directly correlated to our brain chemistry and how we feel. And when we practice yoga, we become more increasingly aware of that, because we're becoming more aware about our feelings and how we're affecting our body. So diet does play a part in protecting against against depression. Mediterranean countries have low rate of depression compared to countries farther to the north. And it isn't just because they get more sunlight or have more relaxed way of life. One large-scale study tracked almost 3,500 people living in London for 5 years, found that those who ate a Mediterranean diet were 30% less likely to develop depression. Researchers speculate, and we see this, that the foods in the Mediterranean diet may act synergistically to enhance mood. Olive oil, nuts, and fatty fish are rich in omega-3 and other unsaturated fatty acids that can help restore balance to the body. Fresh fruits and vegetables contain flavonoids and phytochemicals that are full of antioxidants and folates, which are B vitamins. So being mindful of what we're eating is going to significantly help not only our yoga and meditation practice, but our overall well-being. And this will probably dovetail to another conversation and presentation on nutrition. We're going to switch gears now into the third part of our talk today on yoga for insomnia. So yoga can help relax the mind and body for those who suffer from insomnia or other sleep problems. Yoga for insomnia variations that can help calm the mind and body. If you have a hard time falling asleep or staying asleep, yoga might be your ticket to dreamland. Insomnia has many causes, including stress, hormonal changes, chronic pain, etc. Lack of sleep can worsen these conditions, causing a discouraging cycle of sleep deprivation and daytime fatigue. Practicing yoga can help bring balance and peace to your life, which can result in deeper and more regular sleep. Practicing yoga to treat insomnia stimulates the parasympathetic nervous system, also known as the rest and digest response. Learning to relax your nervous system and reduce muscle tension will positively affect your ability to sleep. In the Yoga for Insomnia lecture series and yoga sequences will be some ways yoga can help you get some quality shut-eye. By lowering stress levels, calming the mind, and relieving tension in the body, the soothing practice can be an effective sleep remedy. Certain resting and inversion poses can be particularly helpful for combating restlessness and insomnia, especially when practiced in the evening or in bed before hitting the hay. So restoring balance through yoga. When we're coping with emotional pain, a purely mental or intellectual approach usually isn't enough. Although our mind may try to think its way out of pain, it can quickly become confused or trapped in repetitive thought patterns that actually intense our emotional turmoil. When we invite our body and spirit to be part of the healing process, however, transformation can unfold. The ancient wisdom traditions of yoga offer practices that unite the body, mind, and spirit. allowing us to experience deep emotional well-being and restful awareness. When your physical, intellectual, and spiritual selves are working in union, our life becomes more balanced and we become more flexible, both physically and emotionally. So this draws us to another part of the yoga practice. And part of the yoga practice is an act of cultivating self-love and acceptance. And when we are engaging in practices that cultivate self-love and acceptance, it helps tremendously in treating the condition of depression and conditions and symptoms of bipolar disorder, because depression is sometimes described as anger turned inward. Many people were taught growing up that it isn't polite to express anger and other emotions. So they push their unacceptable feelings down for many years, but ultimately these disowned feelings may manifest as depression. If you have been suppressing or judging certain of your feelings as bad or dangerous, you may feel a sense of numbness and disconnection from yourself and others. If you can learn to remove that wall and accept, acknowledge, and love yourself completely, you may find that depression naturally dissipates. Reestablishing this connection inside you is not difficult, but if you have developed a habit of avoiding yourself and your feelings, it will require some discipline and commitment to overcome the old patterns and establish new patterns. So here's a practice that can help. And these are, writing gratitude lists and starting the practice of yoga and meditation. And so this here slide is an offering here in San Diego, California, where I'm doing an integrative yoga series. And I'm going to offer this also online for all international bipolar members. And it's a series of yoga for weight loss, yoga for insomnia, and yoga for mood balancing, where I'm sharing sequences 20 to 40 minutes long that you can do at home to treat and decrease the intensity of mood disorders, bipolar, and depression. So I am so glad to be able to share what's worked for me and my clients. And I'd like to now open it up for any questions, comments, and please let me know how I can be more of service. Thank you.
Thank you so much, Bianca, for sharing all that fantastic information. I'm sure we'll have many questions. I do have one currently that was emailed to me before the presentation. And
yes,
this was the question of, if a particular person is on lithium, do you recommend hot yoga?
This is such a great question. And hot yoga, I studied quite a bit. In fact, there was a time I practiced hot yoga for 6 months straight. And I stopped practicing hot yoga because research and study shows that when we practice yoga, hot yoga, 3 times a week for over a long period of time, it dehydrates muscle fibers. And I started noticing this in my system. And I would suggest, if someone is taking lithium every day and practicing hot yoga, to limit their practice of hot yoga to 1 or maybe 2 days a week, and not to go more than 3. It's a great practice for detoxing and really sweating. However, because of the levels of lithium, and when we look at hydration in the body, which is a very important, necessary element in which we keep our homeostasis as well as coherence of the nervous system, hot yoga would show it would systematically bring the body into a state of fight and flight too much because it's so intense. So I'm not saying that no one should practice hot yoga while on lithium. I would say to limit the practice to 1 or 2 times a week and start practicing yoga in add to your yoga practice by going to a class that's not heated and working in a way where you're engaging your muscles, muscular energy, instead of the external heat creating the muscular energy for sweat. Because the external stimuli is so charging. It stimulates the nervous system, which therefore changes the hormonal balance. And for those who are on lithium, it already is a stress system, and the body's working so hard to digest all of those elements and chemicals in the body. And that is why I stopped practicing hot yoga after 6 months, because I noticed I couldn't hydrate myself at a level which was necessary, as well as I was noticing that I was just feeling tired all the time. And when, not to say that's how individuals feel when they practice hot yoga, but I would certainly suggest limiting 1 to 2 times a week and then adding another practice where you're not in a hot yoga room. So I hope that, and if you would like some more information and perhaps more evidence-based data and research, please do let me know, and I'd be glad to offer that through an email.
Great, thank you for that answer, Bianca. The next question, I have been meditating for years. I'm not particularly kinesthetic though. Yoga has never connected for me. Can you make recommendations on how I might get into yoga? How I can help myself?
Yes, okay, I do. And what I did, and I bought CDs. I remember when I started yoga and meditation very long time ago, and I didn't feel comfortable going to a studio. And so one way, and I have a couple options for you, how to get a practice started and how to start yoga and meditation. So one that worked with me, I had bought CDs. I bought a meditation CD and I bought a yoga CD. And they were, when we had, VHS and and DVDs, but it's the Dell DVDs. And I did it in the comfort of my own home with the television. And I found a yoga teacher who I really liked. And I was really interested in learning yoga from this teacher and meditation from this teacher. And I bought their CDs. And I would get up early in the morning before work, and I would do the meditation, and then I would do the yoga practice. And I did that for like 3 to 4 months, where I started to feel more comfortable. And when I felt more comfortable, then I started to look at yoga studios and gyms. And when I started to feel more comfortable in my body and knowing that if I could go somewhere, I knew what I was doing. So first I would suggest is look online to teachers like Sean Korn. I mean, I need to know a little bit more about this person to recommend some teachers and meditation teachers. But first start within the comfort of your own home. Put it on your laptop, your TV, and then you get more acquainted. Then I would suggest branching out in your community and looking where the gyms are and where they offer yoga classes, yoga studios, wellness centers. And most places offer wonderful new student deals. Another way is to, if you can afford, not everybody can afford this, is to hire a private yoga and meditation teacher to come to your home and teach you. So these are some really great ways. Another great way is there are online apps on your cell phone and online yoga-based classes, like the Cody app. There's one online called Yoga Glow, and you can literally do yoga classes, follow yoga classes online, It's like an online yoga studio, and you can pay, I think it's anywhere from $20, $30 a month, and you have the option menu of taking 30 different classes from 30 different yoga teachers based on your level and ability. And this might give you the flexibility to learn from a lot of different teachers and find a teacher that really resonates from you. And then you could purchase their personal yoga CDs and even see if they're traveling in your neighborhood, or when you're out traveling, or you never know, maybe that yoga teacher will come to your town to a local yoga studio. So certainly looking online and getting some yoga and meditation CDs for your personal use, seeing what's happening in your community with yoga and yoga studios, gyms and wellness centers, what they have to offer, and hiring a personal yoga or meditation teacher to help you get through the first, to get through the blocks. Having a connection with another person is key. When I started my yoga practice, it was my yoga teacher that really inspired my growth in the practice. Having that connection with the experienced and skillful teacher was for me one of the primary influencing factors that continued my practice. Thank you.
Great. Thank you so much for that information. The next question is, what's the best way to slow adrenaline or an anxiety rush?
Okay. The best way to slow down anxiety and adrenaline rush is through your breath. Literally. So we like in yoga, we call it pranayama. Prana meaning life force energy, yama meaning restriction. So breathing in and out through your nostrils is the practice of pranayama, and it regulates the left and right hemispheres of the brain, the amygdala and the hypothalamus. So pranayama breathing is the best way to slow down your adrenaline and anxiety, because it goes straight to the brain and we start to regulate brain chemistry. So you would take your right thumb, place it on your right note, you put it on your right nostril, you breathe in for a count of 3 in through the left nostril, you hold, you take your ring finger, close off the left nostril and breathe out through the right nostril for 3. Then you breathe in through the right nostril for 3, close both nostrils, exhale out through the nostril for 3. Then you breathe in through the left nostril for 3 breaths, 3, 2, 1, hold, exhale out through the right nostril. Then you would increase to 6 breaths, and then you'll increase to 9 breaths. And then after a couple minutes, you stop and you pause and you notice how your system has created a systematic shift. And this is the fastest and best way to slow down the adrenals, the adrenal rush, and anxiety.
Excellent information. Thank you.
You're welcome.
The next question. What pranayama or asana do you recommend to intervene in a deep depressive state? If someone comes to you with a negativistic view or deep sadness, is there something you specifically recommend?
Yes. Thank you for that question. I've worked with many people with severe depression, from 12-year-olds all the way up to 80-year-olds. And without a doubt, what I suggest is we do breath of fire. So there's Kundalini Kriyas. We do power like yoga. So we are moving the body, we're breathing. So I would suggest looking up breath of fire is a Kundalini Kriya that stimulates the amygdala and hypothalamus. I would suggest doing asanas. Those are the yoga postures that create heat So we start getting the body moving. I would suggest Surya Namaskar A, Surya Namaskar B. I would suggest doing back bends, because when we start flexing and flowing with the spine, doctors and yogis alike know that the flexibility of our spine correlates to the vitality of our health. And when we stimulate the nervous system in a way that produces the parasympathetic reaction, the rest and digest, as well as balancing the arousal, it will shift the depression into a state of coherence. It gets out of that negative thinking and into a positive sensation in the body. When we start to have positive sensations in the body, such as feeling feeling energy, it is known that we process 80% of our serotonin first in our gut, and then it goes to the brain. So we want to start processing serotonin. These are the chemicals that make us feel better in the gut, in the GI tract, and then it goes up to the brain. So after doing back bending, forward folding, then a shavasana. So it would be a practice of meditation, kundalini kriyas such as breath of fire, Surya Namaskar A, Surya Namaskar B, back bending series, forward folding series, ending with shavasana. That would be my answer to that question. Thank you.
Wonderful. It's so great to have you today. It looks like that's all of the questions for now. We're so excited to have you present today, and it sounds like we will definitely have some follow-up webinars, maybe on nutrition, etc. And I do want to remind everyone that this has been recorded and will be archived on our website for future viewing or sharing with others. And that if you are in San Diego, of course, she is showing on our screen her special 3 classes that are available to all IBPF members or listeners. And if you have any additional questions, please feel free to email me at dbrown@ibpf.org, and I will certainly forward to Bianca, and I'm sure she'll be happy to answer, and I will send that back to you. Everybody have a wonderful day, and thank you again, Bianca, for sharing all this wonderful information. And we hope to see you at the next webinar.
Thank you so much, Debbie. Thank you, everybody, for your time and energy. And please don't hesitate to reach out and ask any other questions that may have popped up after this conversation.
Thank you. Bye-bye.
Thank you, and bye-bye.